Yesterday I talked about some slides of data and science and medicines, and this is going to be a different lecture. It may not be very evidence-based, but I can assure you that it will have some impact on your day-to-day practice. So I'm going to talk about top 3 hazards that we are facing today in practice. And let me begin by the number 1 hazard, which is fake news today. So there are 3 examples of such fake news that I've put here. First is, there is an article that came in the Indian Express, 1 year back or 2 years back it had come, which said that pushing diabetics to take insulin is a medical scam. So this came in the Indian Express, and it garnered a lot of eyeballs for 2 or 3 reasons. One is that this appeared, this was not anybody speaking, it was a British person speaking. And we Indians always have a fascination for somebody from abroad who tells us about India, who think that it is their responsibility to educate natives of India, etc. So it was from the British. It was not just any British person, it was the editor of the British Medical Journal herself who has actually come down to our little country and is now telling us this thing. So that is another thing. And the most important thing is that it was in one of the big newspapers, and it almost, it occupied one whole page of the newspaper. And like in Bhagavad Gita, they say that Sambhavam Yuge Yuge, that means it happens again and again. This post was put up in 2016, but we are suffering the waves even now, Now this is a third wave, that 10 days back, one patient again WhatsApped this to me and said, see, this news has just come, what is your opinion on this? So this is fake news, which can do anything, including change elections, change the world, etc. So recently, my son, he's about 11 years old. He told me that, do you think this whole world is controlled by somebody playing a video game? So I said, what? No, see, good things are happening, bad things are happening. Some people are winning, some people are losing. Floods are happening somewhere, riots are happening somewhere. Do you think everything is like one big person, somebody controlling a video game, and this is happening and everything is controlled? I said, okay, video game, like God or something like controlling? So no, not God, alien controlling the world. Is it possible? So I was just reading up, and this is a very important conspiracy theory going around, that the world is controlled by aliens. So everybody likes to read conspiracy theories, that aliens are controlling the world, global warming is a hoax, climate change does not exist. But in the field of medicine, when misinformation happens, it can actually kill the patient. Thinking that this world is controlled by, like a video game, by an alien is actually a harmless pursuit. In fact, it's quite entertaining. There's a whole movie made on this called The Matrix. So that's okay, but when it comes to medicine, it can harm and it can kill patients. And many patients have reportedly stopped insulin, including type 2, type 1 diabetes, because of this news out here. Now the second news also is interesting. It says that cholesterol is now officially off the naughty list, says the guideline, because cholesterol is a scam and statin is a myth and things like that. Now the truth of the matter is the US dietary guideline has removed the dietary cap on cholesterol because very few foods contain cholesterol. There is nothing called dietary cholesterol because very few foods contain cholesterol. And if you eat cholesterol, your LDL may go up, your HDL will go up, your LDL-HDL ratio will remain the same. It may not harm. And it's well known that increasing the carbs will increase the bad LDL cholesterol, which will increase cardiovascular disease and lower the HDL and increase triglycerides. So it is a very well known fact. The myth relates to dietary cholesterol. But how the patients or this message has interpreted it is that it relates to serum cholesterol or LDL cholesterol or statins and so on and so forth. So I'm sure that the companies making stents will be really happy. Cardiologists or no doctor is happy to see their patients doing badly, but may not be so unhappy to receive some extra amount of income, So I think because these patients who read all this news actually stop their statins. And there are studies. There's a study from Denmark which shows that fake news results in patients stopping statins, which increases the chances of a second stent or second bypass surgery, which means that the cardiologists and the stent makers may all be laughing their way all the way to the bank. But look at the patient. It is the patient who suffers. And I'm sure no cardiologist even today will want any patient to suffer, because it's proven that statins reduce risk by 20 to 30%. And the third fake news is that, dear friends, this is a message, of course, I'm sure all of you have read the message, but I'm just recalling it. Now that the US doctors admit that HbA1c should be between 7 to 8%, and that is normal, this means that the sugar level is 250, then it is normal. Mean of PP and fasting is 250, and then you are no longer diabetic. It's a very simple message. The American College of Physicians did say that the HbA1c could be maintained at 7 to 8% for many patients, but the American Diabetes Association from the same country did not agree to it. And more importantly, there is a factual error in this very message. If you see this message, HbA1c of 7 to 8% does not translate it into an RBS of 250. HbA1c of 7 to 8% means the mean blood glucose of 153 to 180. It's not 250. So that is an internally conflicting message, which is clearly fake, false message going around. So this message says HbA1c should be 7 to 8%, so sugar should be more than 250. No, these are totally incompatible things. But unfortunately, as I said, patients see all this and start questioning things, and we have to fight. So how would we fight? So I think it's a world where people are willing to listen to advice from anybody except their doctors. Why? Because there are people who can speak well, market themselves well, talk well, and communicate better than doctors. We spent 4.5 years of MBBS, then do 1 year house surgery, then we again do MD, then some of us do DM, then we study. I still spend an hour or two every week going through the journals and literature. At the end of it, if my patient doesn't want to listen to me, what should I do? I should be a better speaker. I should be a better communicator. I should also learn to up the ante and fight this fake news, not to save my practice or to save my profession, but to save my patient. That's the key here. There are two of my friends, both endocrinologists, who took to Twitter this very aggressive tweet actually. He tells the editor, think before you give interview to the Indian media, how awkward the outcome it is. Do you really think all endocrinologists are fools to put their patients on insulin? And there is another reply by another friend of mine, Dr. Anantharaman. He's from Bangalore. He said, God, hypocrisy. The BMJ editor is here to milk the brand and make money and develop a successful franchise in India, giving sound bites to the press on insulin therapy, and look at the headlines. So to put it very fairly, I did read the whole article, and she was trying to say something else, that not everybody needs to be put on insulin, etc. But it was construed as something else. And recently, not to be very political about anything, but I think there was a report of some country talking about something that India should not be like this or India should not be like that. And the Indian government said that no foreign power has a locus standi to talk about India. Similarly, I think it's time that we decide that our own specialists in our own country, which is rich and full of good specialists in diabetes, they should have more locus standi to speak about our problems. I'm not saying we should react like this, but I'm saying that there are people who are willing to take cudgels on behalf of the patients so that patients don't benefit. I also read this and I put up on my Facebook page a personal post. One was on HbA1c and one was on insulin. I put up my views very clearly in a very polite, diplomatic, scientific manner. I think I was surprised by the number of views it got, because I did not put it on my personal page. I have a separate public Facebook page on which I put it, so that my friends and my relatives don't have to listen to all this. But I have a public page where people actually said, and I was surprised to see the response to it, because that much there is a desire for knowledge that all these people have. So that brings me to the hazard number 2, which is dietary fads. Now, I don't want to talk ill about anybody, because I am not a dietitian myself. and I don't want to talk about anything I don't know much about, but this was a news that appeared that diabetes subjects can eat mango. We all know that's not true. Diabetes subjects can't eat fruit because fruits contain fructose. Fructose goes to the liver. Fructose doesn't need insulin to get into the liver. Unlike glucose, fructose directly goes into the liver. It causes de novo lipogenesis. It leads to fatty liver. The fat is exported out, and the fat exported out goes all over the body and results in central obesity, worsening diabetes. We all know that. But this message went out to patients, and a lot of patients started questioning this, and luckily even some of the very well-known people from the ICMR started tweeting that mangoes, or that people should actually listen to their doctors rather than before they take mangoes or take ghee or take laddus. So I think it's very important that we speak out, and this is my friend Om Lakhani from Ahmedabad, and many others, including Dr. Parikh and Dr. Banshi Sabu, who have all written against the so-called Dikshit diet, which is a 2 meals a day. And he's written an open letter in which he's solved all these, he's given a point-to-point rebuttal of all those issues, which Dr. Dikshit says that same amount of food releases, irrespective of the amount of food you take, the insulin would be the same. So this is there in the public domain, and we as doctors must now write more, speak more, so that our patients benefit. Well, the truth is that you can fool all the people some of the time, some of the people all the time, and you cannot fool all the people all the time. So now today, many patients are realizing that they may like to listen to somebody saying that mangoes are good for diabetes, but they will not go and take mango. They may try the intermittent 2 meals a day Dikshit diet for some time, but many people are now coming back with high sugars after that and coming back, and we are putting them on ordinary diet because ye public hai and they know everything. They know everything. They will come back to us because they know everything. So what I do, I'm quite happy that people, when somebody comes and tells me, Doctor, I want to follow this Dikshit diet, I say, okay, do you know the benefits? Oh yes, I know the benefits. Do you know the risks? I know the risks. So I'll tell you the benefits and the risks once more. Okay, now they've heard the benefits and the risks. I'll tell them, okay, now you know the benefit and risk, you want to follow it? Okay, you follow it. They follow it. After some time they come and say after 2 months, oh doctor, my sugars are down, my medicines are down. Can you stop my medicines? Oh sure, the sugars are down, we are happy, right? We are here to see you happy and your sugars cured. We are no problem. Stop the medicines as required. Then after some time they come after another 3 months, sir, my HbA1c is now 9% because I am not able to follow this diet and my sugars are high. So I say, okay, come back to daddy. Come back to daddy. It's time. Come back to daddy, and or mommy, come back, my son. But it shouldn't be too late, like this movie, It shouldn't be like, that, like Amitabh Bachchan going back to Dilip Kumar in Shakti, and, you know what I'm saying. Don't make it too late, but come back early and then we can treat them. And some of these people, let me put it in perspective. Some of these people in this 2 meals a day diet, actually, they are not diabetic. They are pre-diabetics because of poor diet, exercise, smoking, lethargy, sedentary life. They are pushed into diabetes. But those people actually, Dikshit diet is good because they get into some discipline. So we are also happy that they don't come to us because they get their problem sorted out. Some discipline comes. And for the other people who really want to try it at their own risk, knowing all the risks and benefit, come back to daddy. Because as in this movie they say, somebody says, mere paas maa hai, Shashi Kapoor. Somebody will say, somebody may say, mere paas social media hai, mere paas TV hai, मैं न्यूज़पेपर में हूँ, मेरे पास व्हाट्सएप है, मेरे पास सेलिब्रिटीज़ है. वी कैन ऑलवेज से मेरे पास पेशेंट है. और दूसरा, यू कैन से दैट इफ यू हैव रेड द एविडेंस, यू कैन से मेरे पास पब्लिकेशंस है. बिकॉज modern medicine is all about scientific observation and documentation, and that will never go wrong. Intuition, 2 meals a day may always go right or wrong, but science can never be wrong. So before that, before I point fingers at others, let's look at our own, I think I'll take 30 more seconds, if it's okay? Okay. So this is my last point. So I'd like to end by just, the last part of my lecture is that I've taken some time to blame people spreading fake news. I've taken time to look at people who spread dietary fads. Now I'm spending some time to look at our own profession, what's going wrong with us, because we also need to look at ourselves. So this is a 37-year-old lady. Fasting is 102, postprandial 144, HbA1c is 6.4%. Wants a checkup. Is there any need to do a vitamin D? And we must realize that a lot of our packages have vitamin D, vitamin B12. I've seen some of the packages having homocysteine. I think we need to look at this angle of our practice also, which is not essentially good for patients. So we need to look inwards, because I was happy to see this paper which was just presented at the IDEC, which looked at vitamin D in pre-diabetes. This is a D2D study. It looked at 2,423 subjects with pre-diabetes, and were given 4,000 units of vitamin D or placebo, and they were followed up for some time. And it was a long study. It was 44% women. The mean age was 60 years, and irrespective of the vitamin D level, they gave vitamin D. And they found that at the end of, I think this was at the end of 54 months, they found that there was no difference in the occurrence of pre-diabetes. So giving vitamin D to pre-diabetes did not prevent eventual diabetes. And that now tells us that it's not just about pre-diabetes. I think vitamin D is only about skeletal benefits. It's not about protecting against cardiovascular disease or cancer or diabetes. So I think anything in which we are testing more and treating more without benefit to the patient, we need to relook at ourselves. It could be subclinical hypothyroidism, which is also being over-treated. It could be B12 deficiency. It could be vitamin D deficiency. I think that is one area which is professionally we need to look inwards to look at our practice. So just to end on that note, I have covered the 3 hazards, and thank you so much for the extra time, ladies and gentlemen, for listening to me.